Okay, it's a little bit after 11, so I think that we are going to begin BCHS's first ever webinar. Thank you all for joining us. I hope everyone is healthy and safe and has had a great summer under the circumstances. My name is Jeff Nemetsky, and I'm the Executive Director for Brooklyn Community Housing and Services. Most of you are here today because you're friends of BCHS, and you've helped further our mission in countless ways. Many of you have reached out to us since March to ask how we're doing and how are we meeting the extraordinary challenges of the day. And we thought that the best way to respond would be to let you hear directly from the experts at the agency who are doing so much to help keep our formerly homeless residents safe. Let me just take a few minutes to do some housekeeping before we move forward. We're going to have each of our each of our participants speak for about 5 minutes. And then we're going to open things up to question and answer. Some of you have submitted questions in advance, and we'll try to respond to those first. If you have questions today, please go to the bottom of your screen. You can click on the QA icon that's there, type in your question, and just hit send, and then we'll try to respond. We'll try to respond to all the questions that are submitted, but we may not be able to get to everyone's question today. This format is 100% new to us. I did not know what Zoom was prior to February, so please bear with us if there are any hiccups during the process today. Now it is my pleasure to introduce our expert panelists. Wendy Junius is our Assistant Executive Director. Wendy has her master's degree in education and has been with BCHS in leadership positions for 27 years. And she was the director of our Arborean Family Shelter prior to her current position, where she oversees and leads all of BCHS's programs. Michael Ash is BCHS's clinical consultant and the head of our Fresh Start initiative at Arborean. Mike has his LCSWR and CASAC certification and more than 30 years of high-level clinical experience with families and individuals. And Mike has worked with BCHS in a variety of senior capacities over the last 20 years. And Ajane Lewis is BCHS's activities coordinating supervisor. Ajane has been with the agency for 8 years and holds her master's degree in art therapy. And Ajane develops and runs a wide range of our clinically based recreational activities and groups. So let me just say a few additional things before turning it over to our panelists. BCHS is committed to ending homelessness in Brooklyn, and we provide housing for more than 400 formerly homeless and at-risk individuals and families each day, the majority of whom have some form of mental illness or other special need, and many of whom have survived domestic violence or other abusive situations. A hallmark of our approach is creating a sense of community for all of our residents, and reflecting this approach, approximately 300 of our more than 400 residents are in shared living situations, where they're sharing living rooms, kitchens, and bathrooms, and are living together with suite mates and with roommates. So some of the core challenges that our panelists had to confront and which they'll address with you today are: one, how to keep our residents healthy and safe, particularly given the heightened risk of living in a shared environment. Two, how do we keep our residents' hard-won stability and mental health intact, despite the powerful triggers that the pandemic brings? And three, how do we ensure our residents don't fall back into old patterns of isolation and withdrawal, especially during this time of social distancing? And let me also identify the broader context for our work. The COVID-19 pandemic has put a spotlight on how communities of color, low-income communities, and vulnerable people are at greatest risk during times of crisis. While there is now a long overdue public focus on racial inequities and injustice, these are issues BCHS sees, experiences, and tries to respond to firsthand, and that has never been more true than during this time. I am grateful that thanks to Wendy's strong and dedicated leadership, Mike and Ajane's skill and expertise, the resilience and round-the-clock efforts of all of our staff in every department, the support and commitment of our board, and especially the courage of our frontline workers, we have been able to keep most of our residents healthy and safe. To date, roughly 2% of our residents have tested positive since March, compared to an 8.5% positive rate for all New York City residents who've been tested for the virus since the start of the outbreak, and compared to an estimated infection rate of 20% citywide. So let me turn things over first to Wendy, who will give you an overview of how BCHS acted quickly to reimagine and reorient our programming.
Thank you, Jeff. As Jeff said, my name is Wendy Junius, the Assistant Executive Director for Program Services. And in my role, I supervise and manage all program-related activities and compliance and regulatory standards. Interact with agencies such as Department of Homeland Services, State Office of Mental Health, City Department of Health and Mental Hygiene, and State Office of Temporary and Disability Services. BCHS provides an array of services to individuals living with mental illness, which is approximately 75% of the population, domestic violence, 50%, substance abuse, 25%, 85% of our clients have history of homelessness. Our overall population has an increasing number of geriatric clients who have serious medical conditions. In addition, we have one family program that is a transitional homeless program, and they make up 15% of our current homeless population. We have two types of housing, shared housing and self-contained units. Navy Green and our scatter site supportive housing makes up our self-contained housing units. Navy Green is a 97-unit single occupancy program with clients living with primary diagnosis of mental illness and low-income single adults. Scatter site supportive housing is single adults with a mental illness living independently in one-bedroom or studio apartments throughout Brooklyn. Later on, you will hear me describe another type of scatter site housing, which is under the shared apartments, and those are our 2- and 3-bedroom apartments. Then we have shared apartments, which are Oak Hall, Arbor Inn, Ivy House, and again, as I said, scatter site shared apartments. Arbor Inn is a family shelter for single mothers who have one child up to 8, and they live in single bedrooms with shared common areas. Oak Hall is our single room occupancy program for single adults with a primary diagnosis of mental illness and also low income single adults. They share suites, bathrooms, and common areas. Ivy House single adults lives with a persistent mental illness, sharing common areas, bathrooms, TVs. In addition to Ivy House, they get 3 meals a day and 2 snacks with 24 hours supervision. To speak a little bit more about a scatter site program, which is an apartment treatment program, it's an intense supportive services throughout Brooklyn, whereas they receive 2 visits per week from the counselors and the case managers. Then we have our Brooklyn Housing Assistance Center, which is our eviction prevention program, where we provide services to Brooklyn residents who are at risk of losing their housing. Because of COVID-19, in early March, the agency started thinking about how to respond to the virus. We started with looking at how to reduce our staff capacity within the office. By mid-March, the governor issued a pause, shelter-in-place order, which we then implemented the plan that had already been in the works. Within 48 hours, each staff, we had to move 70% of our non-essential workforce to home operations. Our essential staff, then with minimum work travel, no more than 2 days per week, were scheduled within the program. Each program was unique based on its operations, whether they worked on site, covering for security, meal preparations, and all the essentials, which includes maintenance staff and continuous cleaning of the building. Before we could do any of this, we had to cover some essential. We were able to reach out to all clients, inform them about the shelter in place, what that meant. Then they were informed of having a month's worth of medications and food on hand, as well as other essential items. In addition, we had to reach out to each client's providers, exchange pertinent information, and emergency telephone numbers as to how to reach staff in case of emergency and for collaterals. With the virus continuously changing, the agency had to address a number of issues within its best judgment. In order for us to move through this, we provided all staff with who needed it laptops, cell phones, to continue to do the business of the agency, as well as teleconference numbers. And later, our IT department provided the staff with licensed Zoom information. We received, and from there, we were able to continue our clinical work, staff meetings, and our external as well as internal contacts. Now that we have moved forward and had a better understanding of COVID-19, we were able to double back with our clients and discuss more in depth what it meant to shelter in place and the precautions necessary. Therefore, we reviewed with them how to wear a mask, using hand sanitizer, social distance, suspending non-essential visits to on-site services and in their apartments as well, the importance of sheltering in place and basically staying in and not going out unless it was for essential means. We were able to get masks for staff from a staff member, Paula. She donated 250 masks. We were able to also get masks from a board member in his community who made masks for mother and children. The administrative assistants, they worked hard and tirelessly looking for masks through various websites. And eventually the city, state, and government and other stakeholders started to provide all necessary PPE gear for all staff and clients. Our maintenance department continuously cleaned the building, wiped down the doorknobs, exit and entry points hourly. Doctors Without Borders were able to come on and provide an assessment as to how to wear your mask properly, social distancing, how to mark the building to provide limited services that was necessary, and the creation of a hand washing station, which proved to be very important. They discussed the office capacity based on the size, how many staff could work in the office at one time. Because of all these safety precautions that was taken, we only had approximately 2% infection rates among our clients from the virus. As the pandemic continued, and with no end in sight, we also started to identify other issues that were emerging. Isolation issues among our clients, increased use of substance abuse, mental health decompensation was on the rise. And to address the issues, we went to our activity department, and they were able to prepare individual activity kits for all clients within the agency. The clinical issues around substance abuse and mental health was addressed in clinical team meetings with Mr. Ash and then individually with clients as necessary. As issues regarding safety and cleanliness of the trains started to emerge on the news, staff became a little concerned about travels to work. When necessary, they were provided Ubers to get to and from work in a safe manner. They were also given hazardous pay during this time. So as of today, the agency is doing very well. We have a stockpile of PPE. We have weekly on-site visits from the nurse to do vitals and to make sure people are healthy as much as possible. Continuous cleaning and sanitizing of the buildings and limited contact between staff and clients has proven to be very important during the pandemic. And for future reopening, we're looking to do a deep cleaning in all of our programs to ensure a safe return when possible. Thank you so much, and I turn it back over to Jeff.
Great, thank you, Wendy. And now Michael Ash will discuss the hidden crisis, taking care of the mental health needs of our residents during this time of pandemic.
Thank you, Jeff, for the introduction, and thank you, Wendy, for the segue into this part of the presentation. My name is Michael Ash, and I would like to address the clinical aspects of the operation. A pandemic of this magnitude causes stress and disruptions in and adjustments to everyone's lives and triggers significant emotional complications, including anxiety, depression, and stress. People who are already experiencing conditions related to anxiety and depression are also having to manage their conditions and adapt to the pandemic. So we found that they needed additional supports and services. The most important thing that the BCHS staff did was to be reliable and have a consistent presence. The staff were dependable in this regard and it stabilized the environment. The residents were made comfortable and they felt secure because the staff was constantly available and they had access to staff, which created more of a relaxed atmosphere in spite of the chaos going on in the world. For the most part, throughout the pandemic, people in our programs with pre-existing mental health conditions continued with their existing treatment providers while working on their goals and objectives. The residents were able to quickly gain access to their treatment providers through virtual sessions. Essentially, the residents' treatment services were not interrupted for extended periods of time, and to the residents' credit, they were able to refrain from decompensating and having major crises. There was a time where residents struggled with constantly changing information regarding the pandemic, and they felt unsafe and unsure what to do. In these cases, they were assessed and it was determined that they had the lack of support to help them cope through this crisis. It was then addressed with a sense of urgency so that the residents were allowed to be relieved of any undue stress and distress. The staff were able to individually assess what each of the residents needed so that there was not a one-size-fits-all approach and response. Once this was done, the staff provided the residents with either one-to-one counseling or referrals to community-based services, and the staff followed up to ensure that the residents were able to effectively manage through the crises. Additionally, police brutality and other issues related to race and inequality called on us to review our commitment to anti-racism and anti-oppression as it related to the daily experiences of the people that we service. The staff made every effort to visually see each person on their caseload at least once per week and have a one-to-one session that addressed their concerns. This has given them the opportunity for the staff to assess the person to determine if there were any emergent needs. It was determined that if it was determined that the clinical needs of the individual, or if there was any triggers, that they were triaged. I also made myself available to conduct virtual sessions with the residents to determine the intensity and severity of their symptoms and to make necessary recommendations, referrals, and linkages to treatment. BCHS functions out of the psych rehab model, which encompasses a person-centered approach to recovery, where the belief is that the individual has the innate capacity to decide his or her own best directions in life, and provided that the circumstances are conducive for people to self-maintain, self-protect, self-enhance, and flourish. The staff look to instill hope by providing information about the possible mitigation of health risks through incremental and sustained lifestyle changes. There was a point where there was an initial noticeable increase in substance use among residents. We know that the virus resulted in unstable employment, food insecurity, social isolation, and the need for increased attention to mental health needs of some of our most vulnerable residents. The staff monitored residents closely for any new maladaptive symptoms and addressed them right away. The staff were always looking for signs of which tells them that the resident is withdrawing or who may be in relapse. The staff will reach out to remind the resident of the supports that they could provide. The staff supports the residents by creating a safe and healthy environment around their home. The staff creates opportunities for open and honest communication and actively listen to them. The staff also hold the residents accountable but offer encouragement while doing so. The staff educate the residents about the negative effects of addiction and provide them with health risk factors related to their lifestyle choices. They are also addressing practical issues with the residents, such as taking care of their bodies, getting proper sleep, exercising, eating a healthy diet. The residents are supported with keeping in touch with their peers and family and advise them to stick to as regular schedule as best they can. People in recovery usually benefit from maintaining a normal routine. It is advised that they reinforce their recovery by staying virtually engaged in programs, reading recovery-oriented literature, practicing prayer and meditation, being creative, completing arts and craft projects, as well as staff making referrals to Ajane Lewis, Activities Coordinating Supervisor. I would like to share two stories with you. I have one, which is where there was an Arbor mom tested positive for COVID after giving birth to her daughter in March. She was then quarantined for 30 days at the Radisson Hotel in Lower Manhattan. The Department of Homeless Services contracted with a variety of hotels within the city where they reserve rooms for residents who tested positive for COVID. Since the resident returned to Arbor Inn, she and her 4-month-old daughter has a clean bill of health, and each of the family members are now thriving. I have another Arbor Inn mom tested positive for COVID in May, and she is placed in a different family residence that had private units, which were reserved for families where someone tested positive and needed to be quarantined. And she was also returned with her 7-month-old, and the results are negative. In both cases, the Arbor Inn staff worked closely with each of the residents, and this ongoing collaboration consisted of updates on the family's health and mental health, providing support with continual referrals within the community, and providing updates to DHS along with assisting the residents to return to Arbor Inn. This made a big difference where each of the residents received a heightened level of support, and the community at large was able to sustain a level of calmness amid the crisis of a pandemic. Thank you very much.
Great, thank you, Mike. And now Ajane Lewis will discuss how our residents need community building and socialization during this time more than ever.
Thank you, Jeff, for the intro, and Wendy and Mr. Ash for the in-depth explanation of how we have coped with this pandemic. Hello to everyone once again. I am Ajane Lewis, Activities Coordinating Supervisor for all BCHS Client Activities Program. As stated before, yes, I hold a master's in art therapy, but I am in the process of obtaining my licensure as we are transitioning into providing this form of therapeutic service for our residents. Just as all areas in the agency, the pandemic has affected the activities program and how it normally functions. As everyone else, we are now placed under strict restrictions, leaving us with limited contact with the residents. But we have found ways to continue our program through conversations and careful planning. We were able to find an alternative way to still provide the residents with their activity services. With the support of Mr. Ash, a part of my lifeline in knowing what creative interventions to provide for the residents is by my attending the weekly clinical sessions for all 5 programs. Not only is my attendance important clinically as the art therapist, but it is also important when deciding what activities will work best for each program. This form of interaction with the staff helps guide me in deciding the best types of group interventions that can be provided for that program and its clients, or if a client may benefit more from a one-on-one session with myself. It also helps me determine those who may not benefit from attending one of my sessions at all. Attending the clinical consistently provides me with a new perspective and a double lens in my clinical and traditional activity approach. It gives me a clearer understanding in addressing the client's needs, their diagnosis, and their presenting symptoms. Many of our residents, much like many people in the world, are going through those heightened feelings of anxiety, which can lead to their depression and leaving room for them to want to feel more isolated from staff, their peers, and even their family members. These feelings can also arise or expand through their lack of being able to attend our weekly activity group sessions. One of our core approaches to working with the residents is through the many activity groups and holiday events that we have. Their game nights have been stopped briefly, their art groups, their gardening groups, even their seasonal movie nights, and most importantly, their traditional holiday barbecues, which are very limited at the moment. A part of our main work within the group is to improve their socialization skills and their interaction skills. It has now become our focus to address the residents' feelings in a safe yet creative way. Providing the activity care packages was a great intervention that allowed them to safely work creatively and hopefully provide some form of mental release. The beginning makings of the care packages started with donations from board members and blossomed into a full set of items and worked collaboratively to create the care packages. As seen here, the items that were provided in the care packages were a reusable tote bag, adult coloring books, word search and puzzle books, traditional puzzles, children coloring books, children educational activity books, colored pencils, crayons, mandala books, traditional pencils, and light refreshing snacks, along with a bottle of water. Who wouldn't love that? As I just briefly mentioned, the agency barbecues for the summer holidays no longer function in its traditional fashion. When realizing that the barbecues wouldn't be able to happen traditionally, we had to figure out a way that would not make the residents feel as though something else is being taken away from them. So we decided to still put on the barbecues, but scale them down. Our main goal was to bring a sense of normalcy by providing a burger, a hot dog, chicken from the grill, along with a refreshing drink. So how did we do this? Myself, Wendy, and other staff communicated and we set a plan. We had a limited number of staff present that day and took safety precautions by preparing prepackaged meals. Having the residents attend in small group sessions, standing 6 feet apart as they collected their meals and we checked in with each resident as they passed by. Such by having a simple conversation, beginning with a simple hello. How are you doing? How are you feeling today? This opened up the door for them to provide some type of feedback as to how they've been coping throughout this time. This also helped give the residents that space to interact from a safe distance and not feel alone. Not being able to provide the traditional holiday barbecues is a change for all of us. So it takes the efforts of all the staff to work together and bring that sense of community back in a safe way. Thank you.
Great, thank you, Ajane. And now we're going to open things up for question and answer. And again, you can go to the bottom of your screen and click on the Q&A icon and type in questions if you have them, and then we'll respond. Let me start with one of the questions that we did get from one of the participants in advance of today. Wendy, I think this question is for you. What do you do when you learn that one of your residents has tested positive for COVID?
Yes, so once a resident has tested positive for COVID, we move to isolate them immediately. If they're in a self-contained unit, they can remain in their unit for 14 days or whatever the recommended self-containment is for that particular client. Other clients in share units, the city provide either shelter services that self-contain in other shelters or hotel services in one of the hotels. We make a recommendation based on the contract that that client is placed with us under, and from there, they are provided a self-contained unit. It may take up to 48 hours for a client to be housed in a self-contained unit. Therefore, we have identified 2 locations within our Brooklyn Garden site, our daycare, which is currently offline, and our community room, both which have bathrooms and kitchens so that individuals who test positive can self-contain safely until we can move them into other units off-site.
Great, thank you for that. Mike, this question I think is for you. During the first weeks of the crisis in March and in April, how did the residents respond? And did you and the staff have difficulty helping them understand the nature of the crisis?
Initially, people were confused because of the constantly changing information. I think with the staff being consistent, having this consistent presence, they were able to stabilize the environment. It wasn't a struggle. It was just the fact that as we got information, we communicated it immediately, and we helped people to determine how to get back, linked back into their treatment providers. So it reduced the anxiety and depression.
Great. And Wendy, I think this question is for you. Just how are your staff doing? How is the morale? How are they holding up?
Staff is actually doing really well. The morale is really good for the most part. We have done extra things to help them out, such as when staff is working on site, they are provided at times lunch that could include pizza. There's always snack, coffee, and juice available. This limits them having to go outside for anything, but also brings a level of comfort to the work environment. Staff is provided all the PPE gear they need to make sure they feel safe. Because they feel the support of the agency, I think the morale is pretty good for our team members.
Great, thank you. Mike, I think this question is for you. You had mentioned in your presentation that initially there was an uptick in a relapse or substance abuse issues. How is that going today?
Well, that stabilized pretty, in the beginning it was an uptick, but subsequently it stabilized. People were able to link in with their peers now that you are able to do more face-to-face today than a few months ago. But even in the midst of everything, they were still able to do virtual 12-step sessions. So we were able to assist people to reconnect with their providers, especially substance abuse providers. And so I think at this particular time, it's not a crisis for many people, but there are people who need to be watched closely if they begin to withdraw.
Great, thank you. Ajane, this question is for you. Are there new groups that you are planning for the fall now that you have learned about the COVID environment?
Well, the newest groups that we will have are the art therapy groups, but the plan is to get our old groups back functioning, but virtually. So whether that's the clients attending from their home virtually or on site virtually, sitting in a safe way So whether that be, I would say 3 to 4 clients in a room and I'm present virtually, or our activity specialist is there virtually. But the plan is just to get our old groups back up and running so that we can introduce newer groups into the mix.
Great. And then sort of as a follow-up, somebody just wanted to know a little bit more information about the care packages, what they entailed and what the residents' response was.
Oh, very good question. So the care packages all began with a donation from some of our board members, which was great. But being that we have so many clients and a large amount to service, we had to plan to add in other items to go along with the items that they had. And what was a great way to do that was giving the tote bags, but having prior knowledge of knowing which clients to work with for each program. I had to reach out to all the program directors, find out their numbers. Some we had to make bags for over 100 clients. Another program we had to make bags for up to 96 clients, some for 60 something, and some it's just for 19 clients. But we wanted to make sure that all of our clients were serviced. Once all the items came in, myself and Michelle Sherwin, who is the activity specialist, we took that time. It took up to 2 days for us to divide up the items equally and place them all in the bag. Only the children and the moms received the children coloring books, so things that were catered to the children, but we also catered to the mothers too. And also in each bags for all of the programs, we made sure to have some type of snack and some type of water. We weren't sure how their food resources were at the moment, so we still wanted to provide them something refreshing to work with. Once the bags were completed, we delivered the care packages to each program. So if it was directly on site, we just dropped it off at that building. But if it was off site, we coordinated with one of the other supervisors from a program, for example, Chapel Street, and one of their supervisors met up with us. We dropped off their deliveries, and their case managers, as they visit their clients, they dropped off their care packages to their residents.
Great, great. Thank you, Ajane. So this question looks like is probably for both Wendy and me. Recent research suggests that high levels of outdoor ventilation can reduce transmission of the virus, and is there consideration being given to employ enhanced ventilation? So I will start by saying that we are looking at the ventilation issues, particularly at Navy Green and Chapel Street, in addition to Brooklyn Gardens, and we are talking to the HVAC providers in both locations about what can be done specifically around COVID and issues around airflow and bringing in more outdoor air. Wendy, do you have some more information to add for that?
Well, you covered the spaces such as Navy Green and Chapel Street that have the central units. At our BG, all the units are individualized in the rooms, so there's more control over the airflow there. It's not as much a problem as having central air HVAC systems in the building. So I think pretty much at the 105 location, we're pretty safe. And the central vac units at Navy Green, we are more concerned about our staff workstations because that's where those units are. In the client rooms, they have portable air conditioners, which is a little bit safer, but there are certain filters that's recommended for any AC units that we're looking into.
Great, thank you. The next question looks like is probably for both Wendy and Ajane. How do you address the issue of residents who may not have the necessary technology for virtual activities?
For the residents who doesn't have technology for virtual activities. So a couple things is happening with that. On site, we have locations within the buildings such as Arbor Inn Daycare where we have computers set up where 1 or 2 moms can come in, staff monitoring, social distance, and take care of business such as with HRA, with their case manager if they're off-site and still trying to have a meeting with them, with the other social workers and any other affiliates that needs to work with the client. For the clients in scatter site apartments, they have, all of the apartments have telephones, so we have to do it through teleconference. It will not be virtual. However, we are looking into moving into virtual groups where we will have a limited number of clients come on site. In one of our community rooms, we will have the TV set up because of the smart television technology now. You can do that. As say, for instance, they can do a virtual group with Mr. Ash, and or Ajane could lead an art group. And all it takes is one of our monitoring and security staff on site to set it up, collaborate with the lead person of the group, and it should be fine. Ajane, you want to add?
Yeah, so it takes a lot of communication just to get it rolling. So working with Wendy definitely and Mr. Ash and also our IT department of trying to get things up and running. From more of the activity end, it takes a lot of communication with their case managers. So me finding out what residents are able to access virtually or through teleconference, who are interested and who are willing to commit to be present. And then we continue to plan from there. So we will know ahead of time who will be able to attend, what technical challenges they have, or what technical access they have via phone or through their laptop or tablet. And then it gives us more of a better mindset on who we need to accommodate or how we need to accommodate them.
Great. Thank you both. And this question is probably for Wendy. How do you make sure that all of your 400 residents have masks to wear?
Yes, that is a very important effort. We, as you know, in my presentation, as soon as we got our hands on masks, we started getting masks out to clients. We had supervisors who came by the office, picked up boxes of masks. What we did is we had individual like sandwich bags. We put a certain amount of masks and hand sanitizer in each baggie. They were distributed to the case managers. Case manager made visits to the apartments to distribute the masks. And we rotate that often, ensuring that everybody keeps enough masks on stock in their apartments or in their rooms if they on site or over at Navy Green. So, and there's always masks available, even at the front desk. If a client missed distribution or didn't get get the items in their mailbox. But there's always talk about ensuring clients have the necessary PPE gear as well as staff.
Great, great. Thank you for that. Okay, well, thank you everyone for your questions. And as I hope you could hear, thanks to the truly heroic efforts of our staff, the 24/7 dedication of our leadership, the commitment and support of our board, and thanks to the help and goodwill of so many friends of the agency, we have thus far been able to successfully protect the health and safety of our very vulnerable population and our staff while helping to protect the wider community as well. Let me just take a couple of minutes to talk about what comes next for BCHS. As you've heard, through the presentations, BCHS has remained open during the pandemic and will continue with our hybrid operation of direct and remote services for the foreseeable future. but we'll monitor the situation and stay flexible and certainly respond to any emerging needs as they arise. This might include developing additional socially distanced on-site groups for residents, as well as doing some more one-on-one face-to-face work with residents, again, within the context of social distancing, and may also include handling some additional administrative requirements on site as well. But generally speaking, we are keeping our basic framework for operations that we've been using since March in place. And we are being very careful about limiting how many people we have on site at any one time, so that everyone who is on site, staff and residents, really can remain as safe as possible. In addition, we are hoping that despite all of the terrible, wrenching challenges that are present today, that this also represents an emerging moment when true systemic change to address inequities and injustices that exist because of racism and discrimination may be possible. Therefore, BCHS will bring our public advocacy work more to the forefront in the coming months, informed always by our daily experiences. So we will prioritize working for policies and laws that reallocate public funds so that under-resourced community needs, such as affordable housing, accessible and comprehensive healthcare, robust public schools, affordable higher education, and real job training, employment, and wealth creation opportunities are available the way they should be for every community. We will also continue to prioritize working towards criminal justice and police reform, and excuse me, along with efforts to ensure there is greater and broader legal accountability for discriminatory acts, including stricter enforcement of housing discrimination laws. And we will do all we can to raise awareness always. Finally, I am happy to say that despite the pandemic, we are moving forward with our long-term plans that had been in place. So we're working with partners on 2 projects that will result in the development of 4 new buildings and will lead to the creation of 500 new units of affordable and supportive housing, including for formerly homeless families, seniors, and veterans. And we are planning for the substantial renovation of our Brooklyn Gardens facility. So this is a snapshot of where BCHS is today and where we see ourselves going in the future. Despite all the challenges and unanticipated crises that have arisen and that we've had to face, everything we do is still in service of one basic goal: working to bring an end to homelessness in Brooklyn, largely by helping people move from crisis to community each and every day. A thank you to our experts, Wendy Junius, Michael Ash, and Ajane Lewis, for their wonderful and insightful presentations. Thank you to Kathleen Rivera, our Chief Development Officer, for all her great work in creating today's event, and to Valentina Osorio and Jeff Kessel for their seamless behind-the-scenes support. And really a heartfelt thank you to all of BCHS's frontline heroes. And thank you to everyone who listened in and participated today. We could not do what we do without your goodwill and support, and we are greatly appreciative during these challenging times more than ever. Together, we will get to the other side of this stronger and more united than we were before. On behalf of everyone at BCHS, I hope you have a wonderful Labor Day weekend, and I truly hope to see everyone soon. And if you have questions or want to learn more about the agency and our work, please go to our website at www.bchands.org, and you can email us at the address that's on the screen. Thank you all once more for participating today. We really appreciate your support, and as I said, we truly hope to see everyone soon. Thank you.